doing today?
I'm good. How about you?
Good. So this week we're going to talk about abdominal auscultation and abdominal percussion. It's an assessment where I'm basically going to be assessing your abdominal cavity to make sure your organs and your asymmetry is good. Just checking on that, make sure nothing's in your air fluid, those types of things, okay?
Okay.
All right, so first, I just want to talk to you. So, can you take off your shirt for me? All right, so lay down forehead on your back. That way. All right, come down just a little bit. All right. So first, I just want to talk to you. Can you bend your knees for me? Bring your knees up here. All right. I'm just examining, just looking at you. Okay. Relax. Okay. All right. So, have you ever had any pain?
Yes.
Where is the pain? Can you point to it? Where you feel it at most of the time on your stomach area? All right. On your left side?
Mm-hmm.
All right. What type of pain do you feel?
It's like
Is it like a burning or aching feeling?
more of a burning feeling.
Okay. How do you feel most of the time, like on a pain scale of 1 to 10? How bad?
Like an 8.
An 8? Have you ever been seen about for that?
No.
How long has it been going on?
For like 7 months.
All right. Do you remember anything like that could have happened to make that feel that way?
I was playing football and I like got hit right there.
Okay. Yeah. All right. Do you take any medications for that?
No, I don't.
All right. Do you smoke or drink?
No.
All right. Sexually active?
No.
All right. So I just want to get a little history from you just to keep going my evaluation. All right. So next, I'm just going to observe you. I already kind of looked at you. Everything looks normal. Your asymmetry is good. Just looking at you. Relax. Put your arms by your side for me. All right. Everything looks good there. So basically, I'm just looking for scars or any type of cuts or scars or redness or anything on your body.
Ouch.
Everything looks good. That's why it hurts right here a little bit.
Mm-hmm.
Okay. All right. So first, I want to do an auscultation. That's basically where I'm going to be listening with my stethoscope, listening to sounds. So most of the sounds will be hollow. I'm going to listen for hollow and dull sounds. Most of the time, you got to have hollow sounds coming from your stomach, intestine, bladder, your uterus, and then your solid sounds will be your spleen, liver, and such on. So first, I'm just going to listen at my stethoscope. All right. Just breathe for the right way. I'm starting left side. All right, everything sounds good in there. All right, so next I am going to do a percussion assessment. It's basically where I'm doing the same thing, but I'm going to be tapping you with my fingers, okay?
Okay.
And for that, I'm listening to air or fluid, which could be your abdominal cavity, okay? All right, just breathe for me. You hear the difference in those sounds?
Yeah.
Okay. All right, so next I'm just gonna palpate on you. That means just touching you, just feeling on anything. Still looking for redness or anything. Everything feels good. Just a little bit over here.
Yeah.
Okay. Has it made you better?
Yes.
Okay, that's good. All right, everything looks good that way. No scars or no abrasions or lacerations. All right, so next I want you to sit up for me. On this end of the table, please. Okay, so next I'm just gonna do a special test on you. It's called the rebound tenderness test. So basically, I am going to poke right here. You're just gonna breathe. So I'm just gonna, basically I'm poking in. Do you feel any pain when I come out?
Mm-hmm.
You feel pain?
Yes.
Okay. So if you did feel pain there in someone who's having appendicitis, like appendix problems, it would be a positive test if I press down when I come out, it hurts, okay? All right, and the next one I would have is the iliopsoas sign. So come off on the edge of the table just a little bit more. So basically I want you to sit. What I want you to do is pull your leg up for me, okay? Go. Any pain?
No.
All right, try this side. Go. All right. And a positive sign for that could be some appendix going on with the movement of your movement, because your appendix is right here. All right, and that is going to be the abdominal auscultation and abdominal percussion examination. Thank you. All right, now you guys, so today we are going to do a urine analysis test. That is just going to be you checking your urine with different things such as leukocytes, which are white blood cells, nitrate, your protein, your pH balance, blood, your ketones, and your glucose levels inside your urine. So all you have to do is, it's going to come with a little script like this. You see it has different colors on it. Those colors are going to tell you what levels you are at on each one. So I don't have a picture of the chart, but the chart will definitely correlate to the colors on here. So basically all you do is urinate inside of a cup, any type of small cup or a cup. And what I want you to do is you're going to, I have a Burger King cup, so don't laugh. So all you're going to do is you're going to dip this inside of there. And that's all you're going to do for that. You give it about 60 seconds at the most, around 60 to 120 seconds. And you're just going to let that go through. And you would use gloves if you had to. If you're testing an athlete, I would definitely have on gloves. But since it's mine, I don't really have gloves with me. So you give that a chance to go through. Then it will read to me what my levels are. But I can't read to you because I don't have the chart with me at the moment. But I actually will come back and tell you what my levels were. All right, so looking at my levels, everything looks normal for mine. Leukocytes were normal, white blood cells count was normal, nitrate was normal, protein was a little over in the positive side. The pH balance was normal, which was I think a 5. And the blood was normal, the ketones was normal, and my glucose levels were normal in my urine analysis. And those are done also for dehydration. So if your athlete was dehydrated and they came in the next day to go back to return to play, you would do a urinalysis test on them to make sure they are hydrated and not just telling you that they're hydrated. You have to check those levels. And that is gonna be what a urinalysis test is at home. Thank you. Hello, all right. So next we have our blood glucose testing. That is gonna be for testing your blood sugar. Most people who are type 1 or type 2 diabetic, they are people who test their blood sugar daily, sometimes hourly. It's according to how they have to test it or how their symptoms show. But some symptoms of that may be weakness, dizziness, nausea, hunger, anxiety. Everyone has different types of symptoms. And so when people start having these symptoms, they go ahead and check their glucose monitoring off of this monitor. This one is called the Contour Glucose Monitor. So basically, it's on here. If you turn it on, it's basically going to show you your number. It shows you all your information you need to know. So usually the number, once you do it. So let me take you through that. So You have something called the contour monitoring. That's this. You have something called a test strip. This is the test strip. The test strip is where, if you had the finger prick, you would basically use this lancet. This is a lancet. So basically, if you ever seen someone get it poked with this at the doctor, this is where the lancet is. It has a needle inside of it. You have to change these out after every use. You don't use the same needle or lancet every time. You have to change it out. I don't have the tools with me to put this in, so I will just take you through what it is. So basically, once you have the test strip and the lancet already hooked up, you are going to insert it into the device. And once you insert it, you are going to pick, some people do it on different places, like middle of the elbow, thighs, different places. Everybody uses different palpations. So usually the number one spot is usually going to be your finger, tip of your finger. So if you had it, you're going to go ahead and hold it. You're going to press it. You're basically going to press it into your finger, whichever one you choose. And once you click it, you're going to release. And you're going to massage your finger going up towards where you pricked your finger at. Don't go where you pricked it. Don't go up here pressing. Don't just press. You start from the bottom. You're just going to make the blood flow come up. As long as you have enough, you're going to use the test strip at this bottom part. You see it? You use the gray part, and you're just going to basically, don't just dab it on there. You're just going to get some of that blood on there. And once you have the blood on there, you're going to take it, put the strip inside of the hole right here. And once you get it inside there, the monitor will start beeping. It takes about 5 seconds. Of course, I don't have any blood on mine, but if I did, it'll take a couple seconds, and it'll try to tell you that the blood is coming on there. And once it's finished, it will beep. Once it beeps, it will tell you if you're inaccurate because there's not enough blood or something's wrong. So after it tells me if it's at 93, that'll be good. Anything less than 50 or greater than 250, you need to see a physician or your physician provider. Call them immediately. All right. So once you're done with this, you're basically just gonna take this out. You should have a disposable place where you put these at because it has blood on it. So usually people does this themselves. Of course, in the doctor's office, you wear gloves as a healthcare provider. If I'm checking it for you, I will have gloves on. No contamination with blood. All right, so this is gonna be my needle disposer. So I would drop that in there. If I had the lancets, I would take it out, and it should be a release button. You're gonna press it, and that lancet should come out into your disposable container. And that is gonna tell you how to check your blood sugar. And the symptoms, if most people who have these symptoms, they already know when they're starting to feel funny. So they'll check it, and then that may mean I need to eat something sweet, or I need to take a sugar tablet or something to help them get the sugar up, or something to help them get the sugar down if it's too high. But that is how you take blood sugar. So thank